what are the three most important things of your philosophy that you like to give to like everyone? Like what's the basic like three things that are takeaways for people that Dr. Jeremy Hayman is giving or exemplifying, you know?
Yeah, cool. Yeah, that's actually a really good, thought-provoking question, actually.
I think you've touched on like three really good things. They may be them, but like, yeah, I just throw it out there to you again and just see what you got.
Yeah, yeah. I mean, I think first and foremost, the first thing that came to mind that something that helps kind of guide me and guide my practice and guide my interaction with people, not just in practice, just in general in life. But we're talking about practice here. We have to get an understanding like right off the bat, right? If someone comes in and they said, I've been diagnosed with like stage 3 breast cancer, it's hormone sensitive, it's driven by estrogen, it's HER2 positive. I've got a major family history of this. I'm scared. I don't know what to do. I've heard that this and this works well. What do you think about this? Should I do chemotherapy? Should I do radiation? I don't know all those fears. First thing we got to do is we have to just stop the conversation, right? We have to say, listen, we just stop and take a breath, right? So as soon as the human body experiences any level of stress, right? And it doesn't matter if it stems out as fear or anger or whatever, like the brain, the prefrontal cortex, like it stops working, right? So like decision making and having an open mind and rationalizing just goes out the window, right? So first thing you got to do is it's always important for me to try to do my best to settle that person down. And one of the ways that I like doing that, other than breathing stuff, exercises, which is extremely powerful, we can talk about a few other ways later, is that we got to make people an understanding that they have the power in them to be able to sort of guide all of this, right? So, I'm the doctor, this person's a patient, but I always say, there's nobody else, there's no expert, there's no scientist, there's nobody else in the entire world that knows you better than you. And you may not know everything about your health and all the signs and symptoms and stuff, but you are the leader in this whole thing, right? So we need to work together. There's no differentiation of standards of where I sit versus where you sit. We are a team. My priority is your priority, and we just got to do this together, right? So if you have a thought or unsure about something or have an idea or whatever, then we talk about it, right? And it's not I pretend to consider it, yet I know I'm not going to consider it. Patients have so much insight into who they are and their health and their processes that I often ask people, they'll give me the intake and then I'll say to them after 45 minutes, so I'm okay, so we have all the information we need. So my next question is so you tell me, what do you think's going on? I know you're here to see me because you want the answer, but you tell me what's happening. And I tell you, 9 times out of 10, patients well, I think, this kind of started because of this, and, it's progressed because of this. And I think that I'm aggravated because of this. And they might not be dead on, but they certainly have a lot of information that I otherwise wouldn't probably have if they didn't kind of go inside a little bit. And a lot of times they don't realize what they're saying until they say it. And they're well, I never actually thought about that. I'm well, I didn't think about it. You're the one that said it, right? And then we go from there. So I think that's a powerful tool for working with people. You have to give them the ability to understand that it's about them, right? And then when it comes to cancer specifically, one of the things I always say to people, especially people that are in kind of a fear-bound position, is I'm you got to understand that since you've been diagnosed with cancer, 3 months ago, I don't want to speak for you, but I can basically tell you that every day for the last 3 months, you've been thinking about this, right? So you're thinking about the tumor, the cancer, the growth, the progression, the treatments, all that kind of stuff. Only don't forget, don't ever forget that you're still alive and you're feeling good and you're thriving and everything else. And yes, you've been diagnosed with this, but 99, I just throw a number out there, but I'm probably pretty correct. 99.9999999, whatever percent of your cells, of your trillions of cells in your body are working for you and they're healthy. Part of our job together is to take advantage of that, make sure that your healthy cells continue to work in your favor, and we just ride it basically, right? We we build that side of your health up and we go, right? I'm the cancer is only this this much, right? It's the smallest percentage possible. And
Mhm.
from a mindset perspective too, that sometimes shifts people's minds and they feel better, right? Placebo or real, whatever, they feel better.
Wow, those are some rich points. Yeah, I loved how you brought in like the nervous system part of it and how the energetics of just like emotions like fear can really like dampen the body, the system, the immune system, self-healing. Like that's so important. Yeah, I often tell people that too, that like, we have these senses that we think of our conventional senses of like, taste, sight, hearing, the classic five, and then but introception, like that inner knowing is like so important. And yeah, like you and I, like we have our own, but like we'll never get that rich data from a patient's system or their own body. So that's, yeah, that's so huge. I think what you said too about just like using that, basically that's a mind body approach of being like, yeah, how do we like tackle this from all avenues? And it sounds like, you've had this conversation many times with a lot of your patients, and it reminds me of just like the power of like the subconscious mind versus the conscious mind, and how the subconscious, it's just so much rich and potent energy there that we just need to tap into, and using that for treatment programs, life optimization, cancer diagnoses, like why not?
No, absolutely. Absolutely.
Anything else you want to add, like on
Well, that was only two, right?
yeah, I think I cut you off. I was so
Yeah,
excited. I was just
no,
like,
it
yeah,
wasn't.
those
It's
are
all good. I think the third thing, just as just a thought that's kind of passing through my mind is just, like I think you would strongly agree too, is education, right? So just educating, informing patients about what's going on and what your thought process is and the thoughts around those thoughts. So like if I'm going to be prescribing somebody, let's say I'm going to prescribe like turkey tail or something like that for a patient because they're going to be going into like a round of radiation or something like that, right? So yeah, you have to kind of read your patient. So sometimes it's good for them to know and to understand why you're prescribing this and how it works and what it does and what it's going to do for them and what they should expect and everything else, right? And people, I think that alone, the education is powerful enough, and then the knowing and the knowledge to be able to open up that kind of healing process, or at least help people's bodies to be more receptive to it.
mm,
I mean, some people they don't really want to know. They just want to know what's going to help them, to support them to help make them better. But other people, I just think it's important, right? You can't just, you can't be sitting on a platform thinking that you know it all, and your word is the final word, and they just have to listen to you. It's like sometimes, like I had a patient yesterday who, I mean, there were a few things at the end of our conversation that would be well indicated to support this patient's health moving forward. But one of her major concerns, because of past experience growing up as a child, she just was not able or willing to take, anything other than like a plant in like a liquid form, right?
mhm.
So, she had issues with her seeing her father as she grew up, I guess, abusive and abusing different drugs and medications and stuff like that. So a situation like that, how can you in your right mind as a physician, as a doctor, try and push somebody and prescribe, like a capsulated nutrient or a capsulated mushroom or something, right? So in a
Mhm.
case like that, you got to work with your patient, you got to understand them, and then educate them on, okay, so this is what I would recommend, but because we can't do that, we can do this, and this is why, right? So if they understand that it's not like a lesser therapeutic approach, it's like just because we can't do this doesn't mean we can't do this, right? There's so many options, and when you talk to a patient, you get to know them, and you get to understand where they're at. I mean, that being said, like I'm not, I wouldn't say I'm close to ever being like right on with every patient all the time, and that's part of the art, right? It's like you help them and they come back and you assess and reassess, and then you alter and change and help them again, and, kind of that continual thing. But yeah, I mean, a lot of times, as soon as you listen to your patient and give them information, it's like just opens up a whole new level of understanding between both people.
Nice. Hitting it out of the park there with the third one. That's a that's a good trilogy. Yeah, and it probably helps you as a clinician to really evaluate like what you're doing, like you said, what's worked, what's not, because some of it's trial and error and dealing with different people and values and past experiences, and how to mix that all into an appropriate and effective treatment plan. So
Yeah.
keep up the good work.
Yeah, absolutely. Thanks. Yeah, well, I'm sure you share a lot of the similar approaches too. If I was to ask you your philosophies, I'm sure, they may be a little bit different, or who knows, maybe they'd be similar. But yeah, it's definitely a shared collective, I think, amongst a lot of us.
Definitely. Everything's, yeah, ringing true in my body for sure with everything you're saying. So, yeah, it's nice to hear. It's refreshing and it's affirming too.